Hello friends, I am Dr. Rohi Kapoor. Today I am going to tell something about carcinosin from this book, Clinical Observation of Children's Remedy. This is one of the very good book. Just have a look. What are the identifying features? A carcinosin state can develop when excessive responsibility is imposed too early in childhood, perhaps halting the child's education. Children who are emotionally suppressed by parents who may behave like Hitler or Stalin towards them. This type of children become carcinosin. Great passion for reading books and hence not much interested in sports and other games. Parents and other elders who give excessive care and protection frequently suppress the development of a child's personality, inviting a carcinosin like state. Overly strict and ambitious parents can also cause the carcinosin state. Passionate and ambitious children who aim to fly high in life. Precocious children talk and behave like adults, very good observers, and curious to learn new things. Universal love for animals treats them just like family members, caring, hugging, and talking with them like this. These are all the mind of the carcinosin medicine. You can see what are the physical features. Blinking eyes or busierietics, for example, tapping the head with the finger, biting the nails and the skin around the nails. Clinically useful as palliative remedy in common congenital dysmorphic syndromes like Cry-Duchat syndromes, in case of Down syndromes, Edwards syndromes, Hallermann-Streiff syndrome, just like the Kestra. There is a history of recurrent infection like bronchitis, gastroenteritis, malaria, measles, mononucleosis, mumps, pneumonia, sinusitis, and tonsillitis. In this type of, when there is a history of recurrent infection, we can give the medicine carcinosin. It works wonder. Okay, now have a look here. Other important symptoms of the mind: clairvoyant, bashful, and timid children, anticipatory anxiety before exams, and a strong fear of performing on a stage. These are all the symptoms, other symptoms of the mind. Strong sense of attachment to family members and friends, like this. These are the adventurous children, affectionate children who likes to show and receive affection in the form of cuddling and being caressed and rocked, just like this. You can see these are all the other symptoms. Now have a look about here how the hair or hair, there is a premature graying of hair, dandruff is there. About the eyes, blue sclera, long eyelashes, twitching of upper eyelid, styes on the upper eyelid. This in nose, in case of nose, you can see chronic and persistent epistaxis, coryza and dry cold air, frequent attacks of hay fever with asthmatic breathing, nasal obstruction in the morning on waking and when going from cold air into a warm room, pain at the root of nose with headache, paroxysmal sneezing, especially in the evening, like this. On examination, there is adenoids present. Other symptoms: this is the face, mouth, throat, stomach. You can see desire for bacon, bread and butter, cheese, chocolate, cola, cold food, and drinks, cold milk, cream, delicacies, eggs, fatty and frenaceous food, fish, french fries, fruit, garlic, ham, ice cream, lemonade, pastry, paper, pickles, potatoes, raw onions, etc. You can see the abdomen, cramping and gripping pains in abdomen, especially in the umbilical region when constipated. When there will be constipation, they will be having cramping and gripping pains in the abdomen. Better by sitting bent forward and by taking warm fluids. On examination, there is enlarged liver or inguinal hernia. Later, constipation in rectum. In case of rectum, you can see constipation with ineffectual urging and straining. Diarrhea in infants with brownish green stool. On examination, there is rectal prolapse or stool. You can see there will be presence of worms. In urinary, there is nocturnal enuresis, obstinate nephrotic syndrome not responsive to steroid treatment, like this. Larynx and trachea, you can see hoarseness of voice, tickling in the air passages, worse in warm room. In respiration, case of respiration, there is asthma alternating with eruptions. Asthma from fright or excitement after vaccination in wet weather, better in seaside and lying in genopectoral position. Dyspnea from running. On examination, there is sighing respiration. You can see in case of cough, there is short cough from tickling in the throat after vaccination or change of weather, worse at night or on waking in the morning. In cold air, when eating, talking or laughing and on uncovering. In case sometimes it will be bloody expectorations. You can see the chest, the extremities, the sleep, skin. You can see in the skin, in case of skin, you can see there will be atopic eczema oozing on offensive discharge, excessive hair growth on limbs and face, dark moles, freckles, keloid, molluscum contagiosum, small soft fleshy warts, spider nevy, like this. Cancerous affection with cachotic emaciation. These are the general symptoms. You can see this one. Child has a strong family history of alcoholism, anemia, cancer, diabetes, leukemia, suicide or tuberculosis. If there will be a strong family history of this type of diseases, then we give carcinosin, especially in children, in case of children. Pernicious anemia, ailments during convalescence after influenza or whooping cough. Bone marrow depression, the brittle bones, chilly, tends to take cold easily, worse from draft of cold air but better in open air. Collagen diseases, convulsion after vaccinations, dwarfishness with arrested development, eosinophilia, juvenile diabetes with tuberculosis, recurrent acute complaints, worse from bathing in sea but ameliorated by being in the sea air. So this is the drug picture of the carcinosin medicine. You can see so many things are there. Yes. Okay, next day we'll discuss something about more about some other drugs. Thank you. Bye.